Thomson is no longer just about maternity care or obstetrics and gynecology. We see all sorts of patients from pediatrics all the way to the elderly, be it for acute medical conditions like food poisoning or cough, colds, runny nose, to injuries as well. It makes me worried about an ACL tear, and what we'll do now is we'll arrange an MRI scan, which allows us to look inside the knee to find out exactly what's the problem.
For MRI, it doesn't have any radiation involved. You can catch things like sports injuries, muscle tears, ligament tears, sprains, cartilage disorders. They can be done frequently, so that's very different from X-rays and CT scans.
How the ACL tear is sometimes we land excessively in our position we call valgus. We have a holistic care to care for the younger population with sports injury or with fracture from trauma or road traffic accident. We also have a good holistic care for our middle-aged and elderly population who have degenerative conditions such as degeneration of the knee, degeneration of the lower back.
Most patients, when they hear the word cancer, they will be fearful, and that's a natural response.
What we're worried about here is that it might possibly be cancer.
We usually try to break the bad news gently, and also we try to break the bad news when they have their friends or relatives around so that it's more comfortable for them, or they have a shoulder to cry on if they need to. Early stage gynae cancers are highly treatable and the outcomes are fantastic actually, and majority of women, they do very well and they go on to live very long lives.
Right now, any oncologists or cancer surgeons, when they see a patient, the first thing on their mind is to include fertility preservation as part of the treatment plan. In terms of preservations, we have very good success rates. So we are able to harvest good quality eggs, good quality embryos, and all thanks to latest technologies as well. So I would say that the success is as best as it can be.
Patients who have already frozen their eggs or sperm, once the doctor gives them a clear sign, that means cancer-free, they can actually come straight away. Because the eggs are already frozen or the embryos are already frozen, then they can just thaw their eggs or embryos and have the transfer.
We did a scan for you after your chemotherapy, and I have very good news for you. The scans are completely normal. Yeah, so we do not see any tumor or disease anywhere. Yeah, so this is very, very good news.
I think the best part of my job is being able to treat the cancer patients and seeing them recover and continuing to live healthy lives.
I think the most gratifying part for orthopedic surgery is to see the patient recover and eventually going back to soccer, going back to skiing, and they send us photos and videos of them doing such activity.
I think at the end, the passion for science, passion for the field itself, and our patients walking through the doors with their dreams fulfilled, and I think that's the best reward we can have.